Hi, this is Dr. Larsen at SLC Med Spa. Today I wanted to talk about the ALMI procedure. This is a great new procedure we've been doing over the past year to replace fat back into the face. As you get older, you lose muscle out of your face, you lose bone, you lose collagen, your connective tissue isn't as strong, and you lose a lot of fat out of your face. When you're young, you notice that young kids have got these nice round fat faces, and they do have a lot of fat between their skin and their muscle. And as you age, you lose that fat, and as we lose this volume, our face sags and it makes us look older. Fat replacement back into the face has been done for years during liposuction, but now there's a new procedure where we can do this right in the office in about an hour to an hour and a half procedure, and with little to no downtime. The ALMI procedure, what we do in the ALMI procedure is we draw blood out of your arm, we spin off all of the red blood cells, and we use the plasma to help the fat take better into the face. There's a lot of people who have had the vampire facial or the PRP facelift, where we take plasma and add that to a filler to improve the results of your filler. Well, in this procedure, we're taking fat, mixing it with platelet-rich plasma, and injecting this back into your face to restore that volume and give you just a really nice natural lift and volume and a really nice natural youthful look. Okay, so to explain the ALMI procedure, the first thing we do is we just draw blood. We'll draw blood and we'll spin off all the red blood cells, we activate the plasma, and we get platelet-rich plasma. That's going to be mixed with the fat. To obtain fat, we're going to get it from either the lower stomach, we can get it from your flanks, or we can actually also get it from the back of your legs. Those are some of the different places where we would get the fat. To get the fat, all we're using is just a small needle. We poke a hole in your skin with a small needle, and we don't use a scalpel. This isn't a surgical procedure. Small little hole with a needle, and then we use this cannula. Very thin, small cannula that it's going to go through that hole. We put a syringe on the end of this and we pull suction on the syringe, and this will go in and out of that hole, and we will obtain about 20 cc's of fat cells. We mix the fat cells with the plasma, and this is what we're going to use to inject into your face. The one other thing we do to the fat cells and the fat is we put it through different filters to micronize the fat. When we micronize the fat, it's almost just like a liquid. It can go through a very small needle. We use just a small needle, just the same kind of needle you would use to inject Juvederm or any other kind of filler. The different places we can inject the fat is we will inject the temples, we will inject along the hairlines. Fat mixed with plasma will increase hair growth much more than just plasma would alone. We will inject along the cheeks. We will inject in the skin between the muscle and the skin in the lower part of the cheek. We will inject the fat in the marionette lines to increase volume here. We will inject fat in the smile lines, and we inject the fat under the eyes. So with this procedure, we're getting about 20 cc's of fat. It's probably the equivalent of about 10 syringes of Juvederm. 10 syringes of Juvederm would cost you a lot of money. This procedure is much more economical to be able to treat all of the areas of your face all at once. So ALMI procedure, we get plasma, we get fat through a small poke in the skin with a needle. We get a large amount of product which allows us to address all the areas all at once, and you get your own tissue, healthy tissue, back in your face that restores that volume and just gives you a wonderful, youthful, refreshed look. So that's the ALMI procedure. Thanks for checking in with us today at SLC Med Spa.